Lung cancer is one of the deadliest diseases, silently growing inside the body until it reaches an advanced stage. Many people only discover they have it when they are already at stage 3 lung cancer or even stage 4 lung cancer, drastically lowering their chances of survival. Unlike skin cancer, which often shows visible signs early on, lung cancer can go unnoticed for years. Cancer research has made progress in treatment options like immunotherapy, proton therapy, and targeted therapies, but early detection remains the most crucial factor in survival. The Cancer Treatment Centers of America emphasize that catching lung cancer in its initial stages increases the effectiveness of treatments, yet most cases are diagnosed too late. One of the first major signs of lung cancer is a persistent cough that doesn't go away. People often mistake it for a minor cold or allergies, but when the cough lingers for weeks or even months, it could indicate something far more serious. Chronic cough is often one of the earliest red flags, yet many ignore it until other symptoms appear. This is why regular checkups with a heart doctor or lung specialist are critical, especially for smokers or those exposed to secondhand smoke. A lingering cough can also be linked to esophageal cancer, where the tumor presses on the airways, causing irritation. Some cases of mesothelioma, a cancer caused by asbestos exposure, also start with chronic coughing and difficulty breathing. Persistent coughing can also lead to complications, such as cardiovascular disease, heart failure, or atrial fibrillation, due to the increased strain on the heart and lungs. When coughing is accompanied by blood, it becomes an even more alarming sign. Coughing up blood, even in small amounts, is never normal and could indicate stage 3 lung cancer or stage 4 lung cancer, where tumors invade blood vessels in the lungs. This symptom could also point to other severe conditions such as chronic kidney disease, kidney failure, or even liver cancer if the body is struggling to filter toxins properly. Many cancer treatment options, including proton therapy and immunotherapy, focus on slowing disease progression, but early detection remains the best way to increase survival rates. A lung cancer screening, such as a low-dose CT scan, is essential for anyone experiencing these symptoms. Shortness of breath is another warning sign of lung cancer, yet many people overlook it, blaming it on aging, lack of exercise, or weight gain. Difficulty breathing occurs when tumors block the airways or when lung function declines due to cancerous growths. Shortness of breath can also be a sign of heart health issues, such as heart failure, atrial fibrillation, or cardiovascular disease. A heart and stroke specialist might investigate whether the issue is heart-related, but lung function tests are also necessary. Conditions like chronic lymphocytic leukemia or bladder cancer can also cause breathing difficulties if cancer spreads to the lungs. People with lung cancer often develop chest pain that worsens with deep breathing, coughing, or laughing. This pain can be sharp, dull, or persistent, signaling that the cancer has spread to the lining of the lungs or even other organs. Chest pain can also indicate esophageal cancer, which affects the throat and can cause swallowing difficulties, or uterine cancer if the pain radiates from metastatic tumors. Pain in the chest may sometimes be confused with heart conditions like heart failure or atrial fibrillation, making it essential to consult both a heart doctor and an oncologist for proper diagnosis. Another critical symptom of lung cancer is unexplained weight loss. Many people with stage 3 lung cancer or stage 4 lung cancer experience rapid weight loss without any changes in diet or exercise. Cancer cells consume large amounts of the body's energy, leading to severe weight loss and muscle wasting. This condition, known as cachexia, is common in many types of cancer, including liver cancer, esophageal cancer, uterine cancer, and chronic lymphocytic leukemia. Patients may suddenly drop pounds despite eating normally, and this could be a sign that cancer has progressed. Cancer Treatment Centers of America and leading cancer research facilities emphasize that unexplained weight loss should never be ignored, as it often indicates advanced disease. In some cases, Cancer affects the digestive system, making it harder for the body to absorb nutrients, leading to malnutrition. Colonoscopy screenings are often recommended if there's suspicion of colon cancer, which can also contribute to unexplained weight loss. Extreme fatigue is another warning sign that many people overlook. Unlike normal tiredness, cancer-related fatigue is persistent and does not improve with rest. People with lung cancer often feel exhausted even after a full night's sleep. This type of fatigue is common in several cancers, including prostate cancer treatment patients, chronic kidney disease sufferers, and those undergoing dialysis. When cancer spreads, it affects red blood cell production, leading to anemia, which worsens fatigue. Kidney disease treatment and kidney failure treatment, without dialysis, sometimes involve medications to boost red blood cell count. But cancer-induced fatigue remains difficult to manage. A kidney function test may reveal underlying kidney issues that contribute to fatigue, but in lung cancer patients, this symptom is often linked to oxygen deprivation and metabolic imbalances. Frequent infections such as pneumonia or bronchitis can also signal lung cancer. A weakened immune system, often seen in those undergoing cancer treatment like immunotherapy or proton therapy, increases the risk of recurring infections. People who frequently experience respiratory infections should consider getting a lung cancer screening, especially if they have other symptoms like chronic cough or chest pain. A history of mesothelioma, bladder cancer, or previous cancer treatments can also increase susceptibility to lung infections. In some cases, infections may develop because tumors block the airways, preventing proper lung function. Those with chronic conditions such as diabetes or kidney disease also face higher risks of infections as their bodies struggle to fight off bacteria and viruses. Swelling in the face and neck is another lesser-known sign of lung cancer. When tumors press on major blood vessels in the chest, they can block normal blood flow, leading to visible swelling. This condition, known as superior vena cava syndrome, occurs in some cases of stage 4 lung cancer, where the tumor has grown significantly. Swelling may also be linked to kidney disease, as impaired kidney function causes fluid retention. Kidney dialysis patients sometimes experience similar swelling, but in lung cancer patients, the cause is usually tumor-related pressure on veins. Cardiovascular disease and heart failure can also cause facial swelling due to poor circulation, making it essential to consult both a heart doctor and an oncologist to determine the underlying cause. Hoarseness and voice changes may be a sign of lung cancer affecting the nerves that control the vocal cords. If a person's voice becomes raspy or weak without any clear cause, it could indicate tumor pressure on the laryngeal nerve. This symptom is also seen in esophageal cancer and thyroid-related conditions. Many people dismiss voice changes as temporary or due to common infections, but when hoarseness persists for weeks, further evaluation is necessary. Cancer research suggests that early intervention can improve outcomes, especially if the cancer is caught before it reaches stage 3 lung cancer or stage 4 lung cancer. A combination of cancer treatments, including proton therapy and immunotherapy, may help slow progression, but early diagnosis remains crucial. Night sweats and unexplained fevers can also be warning signs of lung cancer, yet many people dismiss them as symptoms of minor infections or hormonal changes. When cancer spreads, it can cause systemic inflammation, triggering night sweats and persistent low-grade fevers. Patients with stage 3 lung cancer or stage 4 lung cancer often experience these symptoms as their immune system weakens, making it harder to fight off infections. Chronic lymphocytic leukemia and other blood cancers also present with night sweats. But in lung cancer, the underlying cause is often tumor-related inflammation. People undergoing cancer treatment, such as immunotherapy or proton therapy, may also experience fevers as a side effect, but when these symptoms appear without an obvious cause, they should not be ignored. Additionally, those with chronic kidney disease or kidney failure may develop night sweats due to toxin buildup in the body, making it important to undergo a kidney function test to rule out other conditions. Digestive issues like persistent nausea, loss of appetite, and difficulty swallowing can also indicate lung cancer, especially when combined with other symptoms. When tumors press on nerves that control digestion, they can cause sensations of fullness even after eating small amounts. In some cases, esophageal cancer and uterine cancer can also present with similar symptoms, leading to misdiagnosis. Loss of appetite is common in cancer patients, and many people undergoing prostate cancer treatment, liver cancer therapy, or bladder cancer treatment report significant changes in their ability to eat. If lung cancer spreads to the liver or digestive system, nausea and vomiting become more frequent, worsening malnutrition and overall health decline. Colonoscopy screenings are often recommended if digestive symptoms persist, especially in those at risk for colon cancer. Since poor nutrition weakens the immune system, lung cancer patients with digestive problems become more vulnerable to infections, worsening their prognosis. Changes in blood sugar levels can also be linked to lung cancer. Some lung tumors produce hormone-like substances that affect metabolism, leading to abnormal blood sugar fluctuations. In some cases, lung cancer patients experience symptoms similar to diabetes, including excessive thirst, frequent urination, and unexplained weakness. High blood sugar levels may indicate an endocrine disorder caused by cancer, while low blood sugar episodes could signal tumor-related metabolic disturbances. Insulin resistance is commonly associated with diabetes, but in lung cancer patients, metabolic disruptions often stem from the cancer itself. A kidney function test and blood sugar monitoring may help detect abnormalities early, but further imaging tests are necessary to confirm lung cancer. Lung cancer symptoms are often misdiagnosed or ignored until the disease reaches an advanced stage. Many of these symptoms overlap with other conditions, including cardiovascular disease, kidney disease, chronic kidney disease, and liver cancer, making it essential to seek medical evaluation for persistent health changes. Cancer treatment options such as immunotherapy, proton therapy, and targeted therapies have improved survival rates, but the key to better outcomes lies in early detection. If any of these signs persist, seeking medical attention immediately can make all the difference in improving prognosis and overall health.